Welcome to the InfoMullet YouTube channel. If you enjoy this content, please like or share. And if you'd like to support the InfoMullet by becoming a Mulleteer, visit us on Patreon. We appreciate your support. Welcome to the InfoMullet Facebook Live Ask Me Anything. It's a Wednesday again. It feels like I'm doing this quite frequently, and that's because every 3 days or so I jump into this position. Today we have some different information to go over. I want to cover the latest updates that I have on charting the data. Plus I've done, there's a new InfoMullet post comparing the 5 national strategies. If you're linking into this, Facebook should be providing a source now with links in it, so you could click on those links and follow along at home. Also, some housekeeping issues. If you are done with COVID information and just want some light socialization, Mulleteer Marie and I are going to have another Go game tonight on Twitch, 7 p.m. Eastern. So that's just, it'll be streaming, it'll be fun, maybe educational, a little bit about Go, but just a nice social. So to begin with, kind of the lead story is I just checked this morning's data, and for the US specifically, I posted, there's a link in the main Ask Me Anything that shows the 40 countries and 9 regions I'm tracking. That was as of Monday's data. It was posted yesterday, Tuesday. Wednesday, this morning, I went in and pulled the US data specifically for where we were at as of last night. And the key thing I was looking at is the growth rate. And I wanted to kind of explain this growth rate in more detail because I think people are still misunderstanding, especially managers, policymakers, what this growth rate means. So the growth rate last night for the United States was 40%. That means every day there's 40% more cases than there were the day before. And this is just one day data point, but it had been staying at 30%. So it's not like this is a huge outlier, and it seems to be accelerating. The key thing to remember with these growth rates is you can take a simple back of the napkin type calculation, and you take the growth rate divided into 72, and that equals your doubling period in days in COVID-19. So a growth rate of 30% divided into 72 means we're doubling the number of cases every 2 days or so. And that's a very, very fast doubling rate. A 40% growth rate means we're doubling it in less than 2 days. So we're at 6,500 cases as of last night. We will have doubled that to approximately 13,000. And these are confirmed cases by sometime tomorrow morning. And we will have doubled the 13,000 to 26,000 sometime over the weekend. And these are just confirmed cases because of testing problems. And, we've talked before on the difficulty in testing, underreporting the total amount by a factor of 5 or 6. But if it's doubling for confirmed, it's probably doubling for the rest. Now, I've talked about these timelines and these time lags before, and I wanted to put a little more structure around that before we get into comparing the national responses, because the 5 national responses that are out there around the world all deal with how to manage this doubling problem and its relation to the healthcare system. So I thought it's important to go through this and may help managers. When you get sick, when you get infected, that is day 0 from the state of the system. You're infected. It may take then 4 to 5 days to incubate, okay? And the range is 2 to 14, but 4 to 5 days on average. Then you're sick for, call it 11 days on average. And that, again, ranges based off conditions and complications. There's cases up to 41 days. So think about this. You're 4 to 5 days incubation from exposure. You're sick for 11 to 14 days. If you need an ICU, if you're critical critical patient and need hospitalization, part of that recovery window is going to be in that 11 days. And because of complications, it may last longer. So you're looking at a timeline here of almost 2 weeks. And the time it takes for us to find out that you have it is at minimum 5 to 6 days plus the testing time. So let's say testing time, we now get a response in 2 days. That's a week. So from assuming we can catch everyone, which we aren't, from the time you get infected to the time we know you're infected is a week. If you have a doubling rate of 40%, it has close to quadrupled the number of people in the time it took us to realize you were infected from the point you got infected. This is why we're chasing this kind of, we need to get ahead of this. The total cases tells us where we're at, but it's really based on lagging information. The total cases of 6,500 really represents where we were out last week before the social distancing, before the shutdowns, and the growth rate tells us where we're going. Because the growth rate is accelerating us, that tells us that not just is the doubling happening, but it's getting worse, it's getting faster. Now, there could be reasons for this. I mean, we could be testing more and therefore catching more of those cases. I mentioned that usually when you're not testing well, you could assume between 2 and 5 multiple of the confirmed cases. So maybe we're catching more cases and we're decreasing that multiple down. But it's still doubling. I don't think that's sufficient enough to do it. So you have a week that you've lost, and now you're a decision maker. And I'm going to butcher the name, but let's say you're in Ankeny, Iowa, or you're in a college in Atlanta, or you're in an organization in anywhere in the country that's making a decision of what do we base our policy on? Do we send people home? Do we keep them at work? If you're thinking anything longer than 3 days ago, your information is not only out of date, it's out of date by half. Think about the error margin, right? If we're doubling every 2 to 3 days, that means the knowledge that you were basing your decision on is not just a little off, it's almost off by half. And this is why the 5 national responses have emerged to sort of combat this. And I also pulled the data because I think it's important. When we talk about death rates, there's a little bit of a misconception that it's only 80 years old and higher, and that's why Italy's so bad. In the articles I've linked, you'll see that the death rate in Italy is actually increasing over time. And it popped over 8% on Tuesday's post, which means Monday data. So it was over 8%. And because it's increasing, if it was just age, like, hey, people who are old, Italy's got the oldest population in Europe, and Europe's got the oldest population. If it were just age, it would be a constant death rate or closer to a constant death rate. Because it's accelerating, we're seeing this failure to flatten the curve, the collapse of the healthcare system. And I'm looking at data over on my big screen here, and we now have in Italy the data, the fatality rates of 70 or above are above 10%. So we knew that, 10 to 20% fatality rates at 70 or above. But I want to read the other fatality rates because I think people are underestimating the non-elderly population, what it means for them. If you're 60 to 69, the death rate in Italy as of March 16th, 3.2%. So Italy's at 30,000 people. Not all of them are over the age of 80, 3.2%. If you're 50 to 59, 1%. A 1% fatality rate is very bad, especially if this is doubling at the point that we're talking about. If you're 40 to 49 in Italy, it's 3/10 of 1%, 30-year-olds, 2/10 of 1%, and then it drops off. It looks like the drop-off point is, I call it the Logan's Run threshold, right? If you're under 30, the fatality rate in Italy and South Korea was 0. But even in South Korea, if you're over 30, it starts at 1/10 of 1% and then begins increasing from there. And keep in mind, too, this may reflect policy choices where in Italy, they're under wartime conditions and having to triage who gets the ventilator and who doesn't. So those mortality rates may reflect that younger people are more likely to get the critical care, where they may having to make hard decisions. And if you're over 80 or have multiple organ failures, you're not getting the care and you're dying. And this is really what the countries are trying to, this doubling rate of increased exposure, plus the fatality rate being well above the flu fatality rate under many conditions here. China, Italy, South Korea. For people who as young as the 30s, again, it's, the death rate of 8% is an average, but a 1% death rate for 30-year-olds is pretty serious given how fast this is growing. So the 5 responses, and we've talked about this in brief, and again, if you look at the articles that are linked, there's actually a new InfoMullet post going over these in detail. But here, let me pull up here. Sorry, I'm losing my notes here. Okay, so the ones to go through, the 5 policy routes, and these are becoming templates. So they may have started in one country, they're becoming templates for others. The first is the People's War. That's the Chinese response. And I think we've talked about that a lot. People understand it's very authoritarian. It focuses on strict quarantine using physical barriers, military, police, really strict sort of stay in your location and don't come out. Quarantines, that was last night the People's War method. And it's called the People's War. Premier Xi called it that. That's been adopted now by Malaysia. So Malaysia is now the second country to adopt those very strict. The And there's in the article, it goes over the pros and cons. Obviously, one of the big cons is it's very resource intensive. We don't know how well these physical barriers work. Once you have to police all these barriers and people can still get around them. And there's not really evidence it's better than the second form, which I'm calling pandemic panopticon. So panopticon is the concept of a prison where the one guard can see all prisoners at the same time and have total information. It's been used a lot in metaphor of sort of our lack of privacy and social media and ubiquitous monitoring. But in the pandemic response, South Korea, Singapore, Taiwan, countries that had experience with MERS and SARS adopted this pandemic panopticon. And what it was mass collection of information in terms of testing, tracing, surveillance, mass education of the public through multiple medium channels, and then encouraging the population to self-quarantine around infected cases. So they would share all this data on mobile apps, and you would know who was infected in your neighborhood and where they were, so you could navigate yourself around. So the panopticon in this case is not information only held by the guard, it's information shared with everyone so that they can self-manage. Obviously, challenges here to bring that to Europe and United States and Canada is our privacy laws are much stricter. I've heard some reports that President Trump is considering or has suspended HIPAA laws. That may be a move to begin adopting more of this transparency, but there's downsides too. Remember, these populations in East Asia are relatively homogeneous. There's not as much risk of backlash and harassment. So there's going to be some pros and cons as this gets deployed, and it's not clear if this method works once you've lost control of the outbreak. South Korea was able to implement this, and although they got up to 10,000 cases, they've kind of held there. We're already bursting through that limit, and Italy's way over it. In Europe, what you're seeing on mainland Europe, the third response is what I call mobilization and lockdown. Mobilization and lockdown is where they're mobilizing National Guard or their equivalents of it, reserves, a mass mobilization of resources and personnel, both to enforce the lockdown and to support the hospital. Everyone in Europe, you can look at the charts I posted in Europe. France, Germany, Switzerland, Benelux, the Nordic countries, and these are combined. Like Iceland's different than Norway. I'm mainly talking Norway here. These countries are hurting. They're not that far behind Italy in terms of case counts. The question is whether their healthcare system is robust enough to withstand it. Spain is another one. So across Europe, what you saw over the weekend is this mobilization and lockdown when they saw the death rate in Italy spike. And you're seeing, I hate to say it's martial law, but you're seeing things like in France, you're going to get a fine if you're on the street. And by the way, those are National Guardsmen enforcing it. So it's a little bit, I call it People's War Lite. They've missed the chance to contain it, and now they're sort of adopting a lighter, friendlier version of the China approach, but there's no guarantee it won't get more serious as it progresses. The last two, in the US, really Thursday and Friday and over the weekend, you saw what I call the fire break. The fire break is the concept like a wildfire is approaching, and you create a break in front of it that removes all the fuel and the debris or as much as you can. It's to slow or contain that wildfire, and I don't think in this case it's trying to contain it. It's trying to slow it down as it grows so that doubling rate decreases. Now, again, this was only put in place, you saw with all the cancellation of sporting events, festivals, businesses, guidance not to gather in groups more than 10 by the CDC. This is voluntary, though. This is a voluntary fire break. It's not a requirement or a lawful order yet. And that distinguishes it, I think, from what's going on in Europe, where there's a lockdown saying if you are on the streets without good cause, you will get a fine. Some things that are undermining, in some ways the US is good on this because we're ahead of the game. We're probably doing this earlier in our cycle than in Europe, where they sort of missed that window. But we also undermined it by one, a lot of Americans ignored it. The bars were packed, beaches are still doing it. There's a lot of mixed results. And second, the travel ban that President Trump ordered, I think it was Wednesday night, had a catastrophic effect in that Americans came in from countries all over the world in a fear that they would get stuck, came back and got concentrated in these international airports where you had mass crowds for hours at a time, which is prime condition. Think about it. All these people don't live in Chicago where they're arriving. That's just their airport of entry. They're going to go from there and spread to their home area. So if there was a contagion during this Friday, Saturday, Sunday crush at the airports, that's going to spread it all over. So the fire break has yet to be seen whether it's going to be effective, whether it's going to be enough. But for all that we did in botching the testing, the fire break is a better move, especially because it's being voluntarily adopted by businesses. And if your business hasn't adopted a work from home, if you can, clip this next part from the video and hand it to your boss, right? You need to let your people work from home, because the only way that the fire break is effective is remove all the non-essential material, debris, fuel from the way of the fire, knowing that we can't remove everything. There are essential services and some work environments that can't be done remotely. But if you haven't begun preparing, especially like emergency services, first responders, if you haven't begun preparing or training them, you are seriously behind the ball. This thing is going to be, you are going to make decisions today that you are going to regret by this time next week if we're doubling this fast. Same thing with businesses that are sort of holding out and like, we're going to tough it out. Don't give yourself an anxiety attack next week because you didn't make a decision this week. Make the decision now and wait for the data to come in to tell you you were wrong, and then reverse the decision. This is the key. You can reverse a decision later when the data shows you were wrong by pulling people back early or preparing or training them. But if you don't, and the data shows you were wrong in keeping business opens, you cannot reverse that decision later. You can't go back in time and change it. So cut that part, give it to your bosses. The last national response I want to get to, then I'll go to questions. Everything I've talked to this point, the People's War, pandemic Panopticon, mobilization and lockdown, firebreak, these 4 strategies all assume that this isn't going to last for a very long time. And that's a challenge because there's now data coming out that says this may be with us for the next 18 months before a widespread vaccine becomes available. And so you have the United Kingdom comes out with a very unique proposal that says everything those guys did, I'm going to do the opposite. And I wanted to explain this briefly because it's causing a little confusion. I call this induced herd immunity. And what the induced herd immunity approach is, the UK is the only one using it as far as I know. It's based off the Spanish flu model. And in the Spanish flu in 1918, there were waves of contagion. The first wave happened in spring, about now, and it was serious but not catastrophic. The second wave happened in fall and was absolutely catastrophic. And there's some research in the article, I go into this a little more in the induced herd immunity section, that the closing of schools and the quarantine and everything, all those 4 strategies are doing, social distancing, isolation, actually creates a problem that when people haven't gained immunity to it yet, so when you lift those restrictions, the virus comes back in and hits you harder than ever. And that was the problem with the Spanish flu. Now, the Spanish flu targeted the largest part of the bell curve. It's the young and healthy of the population. It has a cytokine storm effect. COVID-19 only targets the elderly. So the theory with induced herd immunity is everyone go out and do what you're going to do. We're going to keep schools open. We're going to keep festivals going. Keep doing what you're doing in the United Kingdom unless you're in one of those vulnerable populations. We're going to isolate you. And what we're trying to do is get everyone who is healthy, who is not going to be impacted as heavily, build up their immunity while we can. And then when we see, there's a careful catch here. They don't believe they're going to be able to flatten the curve forever. But they're watching the rate at which these hospitalizations and sort of vulnerable population sickness grows. And at some point, they're going to say, okay, now quarantine, right? Start now. And the hope is they've gotten enough people to become immune at that point that when they quarantine everyone to flatten the curve and reduce it, they will come out of it with a stronger herd immunity that then helps prevent the second wave of infections down the road. So the UK is now doing opposite of everyone else because of this strategy. And it's not a conceptually horrid strategy. It's certainly better than thoughts and prayers and, all that stuff. But the challenge, I think, with this case is that the doubling rate is so fast, and this is novel. We don't know what's going on. We still don't know. The entire premise of induced herd immunity is that you gain immunity from having gotten the disease. If COVID-19 reinfects people a second time after they've already had it once, this entire theory goes out, might as well throw it away. Likewise, that timing aspect of when you create the quarantine conditions in the United Kingdom that they're watching for, I mentioned the timeline and the doubling effect. You're talking about something. If you say, how many times have we sent an email say, I'll get back to you tomorrow, right? I'll decide tomorrow, or ask me later in the week. And governments are famous for this. You're trying to time something that is literally doubling in scale every 2 to 3 days. If you miss that window by even a week, you aren't dealing with half again the problem. You're dealing with 2 or 3, maybe close to 4 times the size of the problem. And that overage can just as easily create a curve. So in some ways, the United Kingdom strategy is a Texas Hold'em all in. They're putting all their chips in on this strategy. And in reality, the rest of us are doing the same too, because we're all betting that whether it's lockdown, mobilization, lockdown, the fire break, the People's War, all of these variations, they may not be sustainable for the amount of time it takes for wait to the vaccine. So these national responses, and there's a full article on the InfoMullet. It was just posted before the thing being this, explains these, and it's not sure yet which strategy is the best. And there may be another strategy that comes out that we learn from. So I want to pause here and start going back through questions, because it looks like, and say hello to some folks who joined. So Silja, Mike, Heather, Ishmael, Mike, good job. So Tara, Matthew, John, Tony, John, Rory, Ushari, I hope I get that name right, James, Jason, Valeria, Stephen, Toby, Ed, Christine, Jason. Okay, I think I said hello to everyone. Now let's go back to some of the questions. By the way, if you haven't yet, patreon.com/InfoMullet, support the InfoMullet, appreciate that. And now that you're all here, Twitch tonight at 7 p.m., social go game. No mention of COVID really, just teach and go and helping people socialize. So let's go through the questions. Administration is saying that the growth rates will be inflated due to cleaning of backlogs due to newer platforms going through them. Any truth in that? I've been tracking this now for a month and a half, looking at growth rates. The average growth rate during an outbreak is 20 to 30%. So if we're at 40% and the average is 20 to 30%, that's the difference between doubling every 3 days versus doubling every day and a half. Yes, so 40% might be a backlog. It might be the test cleaning out with, again, one data point does not a trend make, but the trend is going up. So I'm watching this go on, and I'll update these charts every 3 days. But so say it is a backlog and we're only doubling every 3 days. Woohoo! That's not a good news, because at 65, instead of being 12,000 or 13,000 tomorrow, will be 12 or 13,000 on Friday or Saturday. We're not gaining a lot of time with this doubling effect. And even if the doubling effect, the rate of growth slows, once you have a large number, it doesn't matter. Italy's been going down. If you look at my charts, I've isolated Italy to show this effect. Its rate of change is declining over time, and good news, it's at 15 or 10%. It's only doubling every 7 days. Well, it's already got 30, 40, 50,000 people, so you double it, it's now 100,000. You aren't just, it's hard to convey with this exponential growth. You're not just, when it doubles, it's not creating an incremental gain. It's literally saying everything you had the day before yesterday is now replicated again in the next 3 days. So all of the growth in Italy from the point of infection to Tuesday, even if they have a 10% of growth, that's going to happen again in full in the next week. So once you have a large number, the doubling rate can go down, but you're still increasing this massive load of burden on your healthcare structure. So how do I feel about opposing Martian law? Well, if we're talking, John asked, if we're talking the Martian with the little shield and the helmet, very Spartan, I'm open to ideas, but generally I'm not in favor of the People's War or this mobilization and lockdown, because I study instability. I study what it takes to garrison populations, right? This is something I do. When you do something that is coercive based, meaning you have to threaten or intimidate or risk fine on someone, that is resource intensive. So let's forget moral reasons or civil liberties, because those are debatable. Let's just look at the math. A coercion is a resource intensive method. I have to physically go and prevent you from doing something you don't want to do. I got to be there. I got to check up on you. I got to worry that you got around my means. Legitimacy is the opposite of coercion. Legitimacy in the case that I do in research is a version of opting in. So opting in methods of legitimacy is like South Korea, where people see the infected on their mobile apps and choose to move themselves around. That, from a resource standpoint, legitimacy is always more cost effective than coercion. And what that means is you have finite resources. You got to choose. Am I using these resources to test, educate, prepare, do community preparation, and equip the hospitals, or am I using these resources to, try and coerce people into getting a quarantine? So martial law, the mobilization and lockdown, I mean, obviously to the extent people opt in because they're scared at this point, that helps. But I'm always in favor of things that are more legitimacy based than coercion based. Let's see. looking through more questions. Didn't the UK abandon induced herd immunity after they got the report that 510,000 people might die? It's possible. News is moving very fast, but right now, I think Ed Cook asked this. I think what they abandoned was actually the, and unless it's happened in the last 24 hours, because this is moving very fast, in which case my post is irrelevant and forget all that. But there is an article that is being passed around by Neil Ferguson as the top line author on it, that is being credited as that was the report passed around this weekend within the UK government that caused the reversal of policy. So I'm pretty sure the induced herd immunity is the actual new policy that came out rather than the old policy, but these things are moving so fast that I can stand to be corrected. How does that work with the 1% of the 30 plus population who will die from the virus? Probably not well. This is a question from Heather. I want to make sure I'm getting my numbers right. Again, I'm citing these numbers from Italy as of March 1st, and it's not 1%. It's, I want to be clear, the 1% that die are 50 and over, or 50 to 59. 30-year-old is 0.2%, so 1/5 of 1%. I mean, that's still a bad number, but it's a different number. Hey, Aaron, good to see you. Matthew, does it seem that the low new cases in China is holding for now? John Sewell asked a good question. As far as I've been charting, China is continuing to hold the lid on its cases. The growth rate is declining to low. The new case route is matching that. The deaths are low. Now, there's a concern, and I've seen the report, that it's too pretty an S-curve. Well, yes and no. One of the things with S-curves is they tend to get really pretty the more population you have, right? If it's small numbers, things get very jagged and noisy. But at large numbers, depending on the scale you're using, it actually smooths out. There's a neat trick. If you look at a number that's got a very large number, so your scale is large, you zoom in on that line and change the scale, and all of a sudden it looks really choppy. So, and that's just a consequence of trying to model large numbers. What I will say, it's very possible China's, put a lid on this, is suppressing information. They did it in SARS. They have motivation to do it, but I'm not seeing necessarily if they're doing it effectively, because the deaths aren't increasing as well. And this is a thing to keep in mind. Whenever we talk about we don't know how many people are infected, well, we do know how many people die from it, unless we're like Bangladesh or one of these other countries that is misclassifying it entirely as atypical pneumonia. In the US, if someone dies from COVID-like symptoms, they're going to get tracked. So one of the proxy measures we have, we don't know how many are affected. It's an unknown. But who dies from it's actually a lot easier to track and a lot harder to hide. So in some ways, the death rate is a proxy that we can use to see if our infection rates are valid. Avoiding some of the, Ed asked a good economic question. I'm doing an InfoMullet on the economic implications. So Christine asked, confused as to why they are saying potentially no school until September. I'm thinking the cycle would be 2 weeks. If we were to radically stop the spread, why are they saying 6 months? So there's two causes for this, Christine. Christine Astros. So the first cause is that, first of all, and I made this talk on Saturday, the cycle of outbreak to containment on the S-curve, at least for South Korea and China, is about 20 to 30 days. Italy is having its outbreak period right now. France and Germany are probably going to start it this week. The US is within 10 days, if not sooner from that. So take that point in time, add 30 days, and that's the earliest you're going to see it start to hit that S-curve. After that, you probably have 4 weeks where no one believes it's over. You don't want to lift the restrictions. And you're talking 2 months from now. So there's a policy consideration. If we're March 18th now, 2 months from now, May 18th, do we really want to start school or just say it's canceled through September, right? It's over. We're just putting it in. That's a policy consideration. The healthcare consideration that's coming out of this induced herd immunity is that we won't have vaccines ready. So maybe it's better to not use schools as transmissions. And this is a controversial point. There's a question of whether children are, how effective they are at transmitting. I know, having daughters, they're like monkey vector zeros for all diseases, so I don't know. But there's this question of school and closure is both policy, does it make sense to open it unless you're going to go through summer, or do you keep it closed for the long term? And this has economic implications on, daycare and help and people like that. It also has, questions of essential services. Tyson, how can nursing homes be protected short of having staff isolated along with the residents? So I can speak from Emerald Heights. My parents live there. They now have 3 confirmed cases. They have 500 residents, 300 staff. I mentioned earlier that they had been using the Life Care Center as a recovery convalescence, so they knew it was coming. They now have it. Their procedures are almost much more like a mobilization and lockdown. They cannot leave without scheduling it in advance. They cannot return. Everyone gets checked almost better, sounds like, than the national borders with the TSA. They get a temperature. They're very careful about who can move where in the halls. Staff is a problem. They, a lot of these residential homes have high schoolers that are working and providing things like the cafeteria services. I did this horrendously on Mercer Island. There was a retirement home on Mercer Island. It was the world's worst waiter. But, high schoolers do this. Their parents are now pulling it back. So I was talking to my mom the other day. The residents themselves are organizing to help fill the gap and take meals back and forth to people who can't leave the rooms. But as to whether staff can be isolated, that's a tough question. I know in the actual medical facility on Emerald Heights, they will go into lockdown procedures. And this is where the actual beds, the hospital beds are in the ICU and things like that. I mean, it's only 4. It's not huge, but it takes care of the folks who, normal conditions. They will lock down that place and quarantine both staff and residents in that facility. They did it for norovirus for a month, and then this hit, and they're locked down again. So, KP, good to see you. What do I see this doing to the economy level? We're talking 18 months of outbreak. Recession, again, I'm going to do a post on economic impacts. I want to be careful of forecasting too much detail because it's a very complex situation. But I think in general, you're going to see a recession declared either Q3 or Q4. The technical definition of recession is 2 quarters of reduced growth, right? So there was already reports coming out in China that the economy in China was slowing down, and then this happened. They're having, really high unemployment. They're having a mass impact. You are not going to contract the U.S. economy by this putting the brake, this fire brake policy has an enormous economic impact. 70% of our economy is consumption. So I am predicting we will be in a recession announced Q3 or Q4. We're actually probably in it now, but we don't announce recessions until there's 2 quarters. So I think you'll see, regardless of the stimulus, it will be a recession. The depth and extent goes into a lot more complicated that I'd like to think about than making up off the top of my head. Karen, how do you think the fact that many teen kids are contracting it symptom-free, so are never tested, affect the projections? I mean, at this point, we have a lot of countries that have a lot of kids. So we're seeing it sort of included in the data. Part of that growth rate that's 30 or 40%, 20 or 30%, includes the fact if there's children that can pass it, it's in that growth rate. So this is, it's doubling fast enough that the worst case scenario is we're wrong again, it's doubling every 6 hours. That doesn't make it much worse than what it already is, doubling every 2 days. So I'm not, at this point, a lot of these individual considerations of kids are important for local planning, schools, things like that. But from a nationwide perspective, which is where I'm trying to focus right now, it's not going to make a ton of difference. It's doubling fast enough that you got to assume it's bad. Regarding mortality timelines, yeah, so what Lei is pointing out here is 2 to 8 weeks for the total time from symptom to death. And this is important for flattening the curve, right? So say you get symptom-free, you recover in 14 days. That's without complications. If you have pneumonia or organ failure or some complication, you're going to be taking up that ICU bed for a lot longer. And I'm going to do this math on the top of my head, but if you think about the level you need to get of growth rate to flatten the curve is at least less than the time it takes to recover under normal conditions from a serious thing. So if it takes you, let's say, 2 weeks, 14 days, you're occupying a bed in ICU from 14 days to recover from these, and I'm just throwing that number out there. Your growth rate can't be such that you're doubling every 2 days, right? Think about it. You got to get your growth rate so that you're under the point where there's an even flow now of patients exiting because they've recovered, freeing up the bed, and then a new patient comes in. And this is where you see Japan, for example. Japan and Singapore have much steadier growth rates. They're doing that balancing now where they're able to maintain it. And Singapore used the Panopticon model. I don't know what Japan used. It was also, there's some concerns. I've seen some concerns that they weren't testing as much, so they may be missing. We'll find out in a day or two. Lei asked, preparing building temporary hospitals. So this is an interesting response. In the pandemic Panopticon in Korea, as Leah points out, South Korea, they reallocated certain hospitals to be just COVID-19 and sort of focused there. This is one way I've talked in the past that There's a way of flattening the curve by distributed networks, not just time. Everything has been focused on time so far, that doubling period, reduce infection rates. Another way is distributing load or managing load from heaviest hit areas. One way to do that is to dedicate certain hospitals for COVID needs, which frees up the other hospitals to deal with the normal things they're dealing with and can focus resources, bring them in. That's the South Korea model. In China, the People's War model, they literally built hospitals. They built one hospital in 10 days. And this was not a small hospital. I saw pictures on it. This is like a major hospital built in 10 days. They built over 12 hospitals during the outbreak in China to house the patients. I don't think that's, construction. I don't know if I'd want to be in a building that was built in 10 days. There's a risk. Some of these things, they used hotels for housing coronavirus patients in China. One of them collapsed. So there's a downside risk of going too fast. But I think the mobilization you're seeing in Europe, the National Guard, they're bringing resources to bear because that way they can sort of at least provide the personnel and begin converting more space into hospitals. The real question, and this is why I'm never pro-panic, right? My concern is as we move folks in to do a distributed network approach into an area that is infected, they're going to become pathways for infection out. Likewise, if we distribute patients from an infected hearted area out, they're going to be a point of natural infection. And this is going to cause concern in populations that are panicked. And from an instability standpoint, plagues, outbreaks, always are accompanied by this kind of othering of the infected or who we think is responsible for the infected. And you may see protests where, I stand in front of the truck because I don't want that truck with the infected patients coming into my area, which has a low case count, because they're coming from a burden area. So this is the real case why I'm still reluctant to be panicked even with all this, because we've got to have the rationality to accept that a distributed network approach is the best way to flatten the curve when we can't flatten it through infection rates. Good to see you, Shushmi. Mike, Jennifer, good to see you. Yep, Jennifer, the other Jennifer reports that Georgia is using state parks with trailers hooked up to RVs. Yeah, you're going to see a lot of improvised facilities and care facilities going on to try and manage this. And this is one thing where an area that, people are in major cities are concerned. Major cities are a little bit better prepared because they tend to have more hospital resources and more ability to quickly convert spare space. Where the greatest mortality rates in Italy we're seeing weren't in the cities, it's in the outlying areas that don't have access to those resources. And this is a concern because the COVID-19, at least initially, is very geographically clustered. And where it starts tends not to be in these big cities. Again, it was outside Lombardy, Milan, these areas. It was in the outlying suburb or rural areas that it hit first. Likewise in Seattle. It's not in Seattle itself. It's on the east side in Everett, Redmond. Now, I'm not saying those are like, rural villages anymore. That was a long time ago. But these are areas that have less resources. So you're going to need to see local governments. In the sources, I include the FAQ and the Furious. Pause for pun appreciation. The FAQ and the Furious has 17 questions or 18 questions that people should be asking their local, state, and federal government. It was designed originally by Sabina to question the Bangladesh Health Ministry. I did a translation, edited for clarity. It's designed to be used to ask these questions of your local, state, and federal officials. And one of them is, how are you planning to house these patients? What are you planning for their care and treatment? Food distribution chain, Heather asks, what is going to go on with the food distribution chain? This is really tricky because remember, our food distribution comes from local areas, not international. So in one way, it's not impacted by as much disruption, say, overseas. But a lot of that food chain is also based off immigrant labor and a very mobile labor. And, there's not a lot of care being taken right now. I haven't seen a lot of discussion of how we're going to care for these populations that may be traditionally underserved to begin with. And because of all the anti-immigration things, may not, you go get a test involves dealing with a government official. And in the past, we have a history now in the last few years, unfortunately, you go to report a crime, you go to do a judicial case, and the immigration folks are waiting for you there. So there's a real concern that some of these labor populations are going to be reluctant to use the testing. And if they're not getting the information and they're at risk and exposed as a vulnerable community, this could affect the worker thing. On the other hand, food production in the U.S., because I've studied this, food is part of instability. So I studied it. In the U.S., let's put it this way. In many developing countries, it's a question of not producing enough food or being able to store it and keep it from spoiling. In the U.S., it's actually how much food we throw away. We waste about 50% of our food. in the US. And there's good reasons, there's healthcare reasons, but a lot of it's cosmetic. I think if there begins to become a food crunch, what you'll see is rather than production ramping up, because you can't grow a turnip faster than you can grow a turnip. You can't just turn on production for food, but you may see a loosening or an easing. A lot of these laws that are sort of what I call buffer laws, oh, the restaurant has to throw away its food every night that's not used, even though it's perfectly fine and could go to someone who need it. Those laws are going to get really looked at and might be adjusted during this new normal we're in, or not new normal, or new weird. There's going to be a lot of things that we're used to seeing that at the end of the day can probably be fudged a little bit without causing a huge problem. And so if it comes to food distribution, I think you're going to see a reduction in the waste by allowing more, relaxing the safety rules a bit. Yeah, Christine points out everyone is leaving the city to small towns right now to distance and likely taking to small towns. Mask of the Red Death. Want to read a good story of Black Death, how that doesn't work out, fleeing the city and going to have a dance. Anyone having dances over the weekend, I use dances ubiquitously for running your church events, your social outings. I know a lot of people here are gamers, gaming organizations still having gaming events. That was a bad idea. And I know it's time in the past. It's water under the bridge. It's water that's not only under the bridge, but it's been mined under the bridge. So we'll put that aside. Don't do it going forward. If you got something planned this week for any of these events, churches, gaming organizations, community events, don't. The next 10 days are going to be a roller coaster for people. And if you can make decisions now that you don't have to regret 10 days from now, and it's not essential or crucial, do that thing. Make that decision. You can always go back and reverse it later. And I know there's harm in this. There's economic harm in this. Trust me, my business has been demolished by this virus. Patreon.com, InfoMullet. But I get there's economic harm. You have an event, if you cancel it, that's a cost. But you can reverse those losses and you can mitigate that harm. And who knows what the stimulus package is going to have. That will be a whole nother thing once we figure out what it is. But you can reverse that harm. You cannot reverse getting infected and passing it on to a loved one. You cannot reverse becoming a transmitter to an elderly home that then has an outbreak and has people dying because of this. You cannot reverse those conditions. So whenever I look at risk analysis, and I do this a lot in my research because, with terrorism and mass violence, these are risk trade-offs. The thing you can reverse, whose harm can be mitigated, is the policy you probably want to do versus the policy you can't reverse, and harm can't be mitigated if you're wrong. So again, if you're planning something this weekend, seriously consider canceling and adjusting it. So Mike asks, having seen a lot of announcements coming from the food distributors, wonder why they aren't making public statements on restocking. I've seen I predicted last week that people were getting tapped on the shoulders and businesses would start adjusting their hours. Within 4 hours, I was getting news articles sent me to the Walmart's doing just that. By the way, Walmart, if you are watching this, Medici vote Mulleteer. But anyways, I think the restocking is probably more to manage crowd flow and staffing considerations than it is the U.S. food production and supply chain. People don't understand how phenomenally massive this undertaking is and how it can power through situations. Yes, there's been some outages and things like that, but we produce a lot, ship a lot, and distribute a lot every single day to a level that would probably astonish most people because we don't see it. I think the shortages will wean themselves out, partly because everyone panicked, went out and bought the stuff. They're not going to need it for another 2 weeks, right? They're home with their toilet paper fortresses hiding behind a wall of Charmin, and they're not going to go out again. So there will be time to restock these things, and I think the level of supply chain disruption, at least of some of these goods, is going to diminish. Now, Tony pointed out last time we were on this, if there's a disruption of trucking, railroad lines, that's going to be more impactful because that's the distribution network, but right now it doesn't look like there is. Okay, Paul asked a good question. When do we determine if reinfection is a possibility? Well, my guess is when P is less than 0.05 in a peer-reviewed paper from a sufficient sample size with adequate power. What that means in English is it's going to take research, and that means time. There's reports of isolated cases of reinfection. We don't know if it's systemic. And this reinfection question gets to the heart of whether any of this works at all. If COVID-19 can reinfect, I'm going to find some papers and throw them up in the air because everything we're doing except the induced herd immunity kind of goes out the window and we have to wait for a vaccine. But when will we know? You're going to need a large sample size. with adequate power of predicting of its effects. It's got a low, its p-value is low, so it's valid, and they're going to have to probably take it from a couple countries to, so it's not just one sample. I think it'll be a while till we know for sure. Selling your home now versus compared to waiting a year. Question for another time, I think, David. Jennifer Hartshorn asking about SERE. I'm not sure what that is. So, Siri. Yeah, that was probably a bad idea, but water under the bridge. Big five for weights to stay fit at home. The gun counter had a huge line. What is the thought behind someone who is gun buying? Yeah, it's not an irreasonable question. So I make this point when people panic. It's like two voices in your head. And one voice is shouting at you, do something, right? Got to do something now. Don't stand still. Move, do. And the rational voice is the quieter voice saying, that's a dumb idea, but, the reason panic is bad is because it puts the shouting voice. And look, people in a panic will do three things. They'll fight, they'll flight, or they'll freeze. And I think a lot of these organizations that continue to hold events are in a freeze mode. They're like, it's too much burden to think about this. I'm just going to continue doing what I'm doing. But those who have a fear risk of the fight aspect or the flight aspect, they may think, where's my safe place? My safe place is in buying a firearm. I study firearm violence. I study criminal violence, and not to get deep in the weeds. There have been many cases of surge gun buying for really dumb reasons in the past 20 years. It does not itself result in an uptick of local violence in that area. It just wasted a lot of wasted money and bad Facebook selfie pics with here's my new gun and stuff like that. So I'm not worried from a violence level. From an instability level, the things I worry about are a little different than that, but that's a topic. One of these days, I'd love to do an Ask Me Anything that's on something I actually research, like mass shootings or terrorism or insurgency or that stuff, but we'll stick with COVID for now. Let's see. Yeah, I think people paranoid about their food supply. Look, people went out and bought toilet paper because they were paranoid for their butts. That's no more of a rational decision, I think, than buying a gun. So you're going to see these manifestations of panic buying and a lot, and other forms of panic behavior. Some are going to be mild and benign. I'd rather honestly have people go out and buy stuff they don't need than start harassing or othering, targeted vulnerable groups. That's the risk I worry about, is sort of systemic harassment. Asian Americans being, this is and I'm using finger quotes here because it's not, this is the Chinese virus. You see a lot of this implicit bias in these things about shut down travel, and we're going to have a travel ban. I've looked at the countries doing these travel bans. Not a one has stranded their citizens or residents overseas. And people don't understand how many people travel the world at any point in time from a given country. So even if you do a travel ban, you're bringing all your people back, and they're going to carry the virus with them. And at this point, it's already all over the place. So the consequence of these travel bans and these border shutdowns is probably feel-good measures. Again, the panic voice is do something, we can pull a lever and shut it down. Saying shut it down sounds really demonstrative and in charge, but I don't think it's really a wise policy consideration, especially given where we're at. I mean, the New York Times had a visualization where this is in all 50 states. Yeah, I don't think that was a good idea. Defense Production Act has been instated. Evictions and foreclosures halted until end of April. Can we expect the government to show up and force you to produce InfoMullets for national security? This is Ed Cook. No, but if the government is watching, Medici Mulleteer sponsor level, support your InfoMullet. I have, full disclosure, I have in the past and currently and likely will in the future do work for the government, but it's very different topics than this. So thanks for that. Many first responders, okay, good question here from Tyson. Many first responders are only wearing N95 and gowns based on positive 2 out of 3 diagnostic questions we've heard over the past month. Fever, cough, travel. Is this incredibly stupid, and should we be protective equipment every call? So this is a key point. There are a lot of first responder units out there that, and I work with the military, and a lot of military go into first responders, and they're kind of a go Rick, CrossFit, gung-ho, I'm going to do 1,000 push-ups and stop the disease and have my protein shake and my fruit. They're very physically fit, and they think, pain is weakness leaving the body. I'll sit there and I'll mentally get through this. This is a really bad idea because it's true that the first responders are going to be some of the healthiest people out there. They're fit. They probably won't die from COVID, but every one you take off from getting sick is one less resource you need in your critical. And the bigger danger is they may become transmission. So think about it. If you're out there as a responder and you're seeing dozens of people a day, yeah, you may be fine to keep working, but this is what happened in the Netherlands. In the Netherlands, they said if you don't feel bad enough to work, you're not infectious. This was a disastrous policy I've documented in the Netherlands, and I think in Germany a little bit too, this kind of continue working and business as usual. And what it meant was people became super carriers. They just continued going about their day, and police, fire, emergency, they contact all the time people going back and forth. So, I mean, you're in a rural area, let's say hypothetically, and Ankeny, I can't pronounce it. You're in Iowa somewhere, and you've got 10,000 people over thousands of acres. Well, those people aren't situated like cattle in fields where they're going to stay still. Bob, this is your grazing pasture. Jeff, you're over there. People move around and come together in choke points. And those choke points are grocery stores, gas stations, hospitals, restaurants, and you can shut those down. But even if you distance someone, people, the responders are moving between these isolated areas. So think about how many places an emergency service person goes in a week, and they're going to touch and they're going to reconnect all those points you just disconnected. And if they're not properly prepared and equipped, they're going to become infected and then become carriers and spreaders. They may be asymptomatic. They may not even realize it. They may feel bad, but I got to work because no one else can. And all of a sudden, you've massively increased the contagion rate. So I really think for organizations, and I'm online, if someone wants to ping me and have this conversation with their chief or mayor or anyone like that where I can help convince, maybe bring a little extra firepower to the discussion, they need to be preparing now for three things. How do you protect your workers day in and day out from becoming super carriers? What are your plans for exceeding local supplies? And how are you coordinating with nearby towns, cities, metropolitan areas, activating those crisis response plans? I'm sure someone's got a binder somewhere that details how to do this. That binder needs to be out, it needs to be updated, it needs to be refreshed, and it needs to be implemented. You should start preparing and training now. The US is 10 days behind where Europe is by an approximate growth rate, but we have a lot more room to grow. We're about the size of 3/4 of Europe. So you think about Europe has about 500 million, we have 320 million. Our overall rate may dwarf any one country in Europe because the countries tend to be smaller. So something to keep in mind. Do you anticipate that this will have any effect on medical patent trolling? Lay, very specific question. I think it's a valid one though, because there's lots of efforts on treatments and who gets to make the first vaccine or where it's being tested. I think what we're seeing right now from governments is that no one's going to be able to patent and hold this on for long. Ed mentioned the Defense Production Act has been invoked. The president's already declared a national emergency. You've gotten effectively martial law in France. The government have means to say, thanks, independent group, for finding this thing. We'll compensate you on some way, but we're taking that and holding it for ourselves, or using it for public use. I think there's enough. I've read the law and the statutes when it comes to military, emergencies. There's enough ways that the federal government will punch through someone who tries to hoard this and make it available for everyone. Whether they choose to do it, that's a policy decision. Any thoughts on how this impacts attention given to other pressing global issues, notably climate change? I think climate change is interesting. So when I was asked in January to make my top 10 things that kept me up at night, I actually didn't list climate change as one of the things that keep me up at night. I listed a novel virus or antibacterial resistant bacteria as the thing that kept me up. That was the #1 list, and I've been gotten some flack for it because they're blaming me for this. But I think what climate change benefits from this is people see the realm of so much of how we order society is choices. And those choices have entrenched institutions behind them, they have momentum behind them. But we're operating in the West in a Maslow hierarchy. If you think of Maslow hierarchy, it starts at physiological comfort, safety and security. It goes up to self-esteem and group identity. In the West, have a buffer in the US, Europe especially, where all our debates are happening at group identity and self-esteem level. This is the red v blue partisan divide. And of course it has real world impacts, but for most people living, they have a buffer of tolerance where they can say, this decision that I'm debating on social media or things like that, climate change, impeachment, whatever, doesn't really impact me directly and immediately. COVID-19 is a little different. A pandemic like this is going to start it already has affected everyone economically and from a business standpoint. It's going to also start affecting people's relatives, loved ones, someone they know, someone they care for, someone in their immediate family, friends. And this is going to drop that Maslow's hierarchy down to where we're dealing with physiological safety and security. And pardon my French, but a lot of bullshit goes away when you're at that level of operation. And so you're already seeing how fast, I mean, the American economy fundamentally reordered itself in a matter of days last week. I mean, and I'm not saying it's sustainable, but the speed at which change happened, I think you're going to see that continue to play out on all these questions. And what that means for climate change is there may be like, hey, you know, remote work is possibly a good thing for climate change. We're not in our cars, we're not driving. Maybe some companies will continue to adopt that. What I'm saying right now is that just like the world was different on 9/11 than it was from 9/10 and continued to be different right through to today, the world is different today than it was probably Tuesday of last week. And it's not going back to that anytime soon. That doesn't mean society is going to collapse or life as we know it's going to change, but it means there will be differences that emerge in the next 3 to 8 months as a result of this COVID-19 that are going to stay permanent, and they're going to last just like issues with, like, no one goes to the airport and is surprised they have to take off their shoes anymore. That was a new thing after 9/11, and that was a very small thing, but it's, you know, noteworthy. There will be things that change because of this that do not go back, and I think to the extent that helps climate change, that might be a good thing. Reading some of these comments, Jennifer said that China actually saved thousands of lives due to the factory shutting down. Yeah, I mean, as an advocate for nuclear power, coal kills, I think, 2,000 people a year at least in mining, multiple tens of thousands of that in pollution. China has a pollution problem that's unbelievable, and therefore shutting down the factories has a notable effect. And that's a trade-off balance. I don't think anyone's going to say, yay, COVID, you know, less pollution, but there is a trade-off balance to consider there. Interesting. Let's see. Any word or not on whether the ACL or others are going to get going after non-essential services that require workers to keep coming into work and burn PTO if they're in? That's a good question. I don't think that's an ACLU question. I think there are groups that will start doing that because I think the ACLU, to be honest, is going to have their hand full with civil liberties violations coming up. That's kind of a downer prediction, but I think they're going to be a little busy with if there's implementation of martial law. I mean, you think about it, the governor of Washington state said no gatherings over 250 people. Okay, no more protests. Well, what does that mean for free speech? I think Massachusetts may have done a lower number, 50 people, right? These kind of civil liberty restrictions are going to keep the ACLU well employed for the foreseeable future, and I think other people will take up. If we find a resource, I'll post it because I know a lot of people are asking about advocacy for workers who don't shut down. A question is liability. Is there a legal liability for the business? You know, negligence, this is going to be a new area of negligence. You got this warning. The CDC said, don't gather in more than 10. You kept your business open. Are you liable for the harm suffered, and can they prove it was because of your business? These cases are going to go on for a decade. COVID-19 lawsuits are going to continue for the next decade answering this question. What do I think about what the UK is differently? Courtney, I actually answered this earlier in the video, so if you go back and watch, it's answered, plus it's in the InfoMullet post. So just rewind if you're still listening, or when I post it on YouTube, you can see it. So yeah, people working in defense-like fields work from home, but also non-essential. I talk to a lot of people in those situations. I work with a lot of people. The defense industry, the defense is taking this very, very seriously. So essential and non-essential in defense often is related to mission sustainment. And a lot of contractors and personnel are classified non-essential. I've been non-essential everywhere I am, and trust me, you don't want to be essential because when the word goes that you get to leave, the non-essential are the first ones out the door. The essential have to stay. I think that when the DoD announced over the weekend that all travel was suspended, this was a huge move and a signaling factor by the Defense Secretary that this was serious. So the DoD, for people who don't track, it has people on temporary duty assignments, traveling for training and all sorts of things. All sorts of people moving around. They locked that down over the weekend and said you will not travel unless it's essential or approved by 15 levels of waiver. I think that's going to send a signaling, and they're going to rapidly move non-essential, non-classified work offsite. I mean, there are, even back when I did this when I was working in the Pentagon 2010-ish, you had ways of logging into unclassed systems with secure sort of key cards on the side of your laptop. I mean, obviously a SCIF, if you're working in a secured, compartmentalized thingy thing, and you're, turning the dial for the on the front, you're going to still probably be doing that because those can't be replicated easily. But the whole point of these fire breaks is not that you get everyone out of the way. And this applies for any of these situations. The purpose of a fire break from a policy standpoint is to get as much of the non-essential fuel out as you can, knowing that you can't remove everything. And the thing is, you're hoping the fire will stop or slow down as it crosses that. Oh, Beth, good to see you. Glad to see you. All right, I think we're at the top of the hour, and I don't see any more questions right now. We've covered a lot. Again, if you have a chance, tonight, 7 o'clock Eastern, Mulleteer Marie and I will be playing Mullet Go, the official game of the InfoMullet when you're socially isolated. It's going to be, there's a link at the top. It's twitch.tv/InfoMullet, 7 p.m. Eastern. If you want to be a Mulleteer subscriber, if you find this useful, informing information, patreon.com/InfoMullet. There's a way to become a subscriber there. Appreciate all the subscribers. Saw a bunch of you today. The InfoMullet post, I've linked a new article just now about these 5 different national strategies where you can compare and link. And I will be doing another Facebook Live Ask Me Anything on Saturday because it seems that people like these 3 days, but I'm hoping to get some coverage out of what else is going on in the world, what else is important, and sharing that over the next couple of days. I've been a little, obviously, busy doing all this stuff, but I will try and get, because there are other stories that are important out there. So, yeah. All right. How do I think this will impact the Navy? I'll probably answer that in another one. I've got a post coming out on instability that will be military related, and I want to cover on economics and instability as 2 separate topics, and we'll probably go into more depth there. All right, everyone. Have a good day. Take care. Be safe. Wash your hands. Don't do this. Right? Don't put your hands in your face. And take care. Talk to you later. Bye.
Thanks for watching the video. Hope you enjoyed it. If you'd like to follow the InfoMullet, visit us on Facebook or Twitter. And if you'd like notifications when we post new video content, click on the red subscribe button below the video. If you've ever wanted to become a Mulleteer and support the InfoMullet, visit us on Patreon. We appreciate the support.